the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We're coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the President and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day, I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. The show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed the show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we are pleased to have a special guest who will speak with us about his experiences with transfusion therapy and his life as a sickle cell patient. Joining me today in studio is Mr. Saleem Adams. We're honored to have him here with us today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be doing in future weeks. We will cover such topics as sickle cell research update, traveling with sickle cell, connecting the sickle cell community, higher education and sickle cell, and many, many others. So, as you can see, we are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. Well, there's several stories to go over with you today, and I think some of them are pretty interesting. And the first one is, to me, very interesting. It sort of echoes things we've talked about on the show before. The headline of this article is Hemoglobinopathies Market Worth $8.8 billion by 2022. For those of you that maybe aren't all that familiar with the term hemoglobinopathy, it is a widely used term, particularly in the medical field, that relates to blood disorders that are similar to those like sickle cell disease and thalassemia. So the article reads, the global hemoglobinopathies market is expected to reach over $8.2 billion United States dollars by 2022, according to a new report by Grand View Research, Inc. The rising prevalence of hemoglobin disorders such as sickle cell anemia, thalassemia, and other related disorders is estimated to be the high-impact rendering drivers of the market. According to the World Health Organization, hemoglobin disorders are present in over 60% of 229 countries, affecting 70% of births. It is also reported that a minimum 5% of the world population are carriers of significant variations. The prevalence of hemoglobinopathies is high in low-income countries such as sub-Saharan regions and Southeast Asia. Approximately 85% of the affected population in the United States and Europe has an ancestral base in these regions. Governments are collaborating with local institutes to undertake awareness programs for curbing the effect of hemoglobinopathy-related mortality rates. For instance, the Thalassemia Data Collection Project and Registry and Surveillance System for Hemoglobinopathies projects were started in 2010 by the Centers for Disease Control and Prevention. Low levels of hygiene, insufficient healthcare infrastructure, and lesser awareness levels are some key factors attributing to the increase in the base of target population in low-income regions such as Southeast Asia, Mediterranean Basin, and Africa. Some of the key findings from this report suggest that the market for sickle cell disease was the largest market, with revenue valued at over $2.29 billion in 2014. The rising prevalence of hemoglobinopathies and the presence of strong product pipelines for sickle cell anemia are growth-promoting factors of this market. Another finding in the report is that genetic testing for diagnosis of sickle cell disorders is expected to witness lucrative growth over the forecast period. It is estimated to grow at a combined annual rate of around 7%. Increasing awareness levels among people, coupled with government programs such as the National Sickle Cell Disease Control Program conducted by the World Health Organization in Africa, are anticipated to enhance the usage rates for diagnostic tests pertaining to sickle cell disease. Hydroxyurea was one of the dominating segments of the sickle cell disease therapy market, owing to the presence of the FDA-approved drugs such as Droxia and Hydrea by Bristol Myers Squibb. The market for blood transfusion was the largest, with revenues valued at over $1.4 billion in the therapeutic segment, owing to a high acceptance level of this treatment option and its significant success rate. It is estimated that around 85% of infants below 5 years of age suffering from thalassemia die to insufficient blood transfusion. And finally, the Asian market is expected to witness lucrative growth over the forecast period, with a combined annual growth rate of over 10%, owing to the presence of high unmet clinical needs, improving healthcare infrastructure, and rising economic levels. However, introduction of low-cost diagnostic alternatives will enhance adoption rates for hemoglobinopathies diagnostics market. This is really important because it does verify that, as others have noted, there is an increase of the cases of sickle cell disease and thalassemias to be expected as we move into the future, and this report just bears that out and puts numbers to it. So that's an interesting story. Another story that's interesting is one that relates to the NCAA, the National Collegiate Athletic Association. The headline of this article is NCAA Put to Fire for Anemia Testing Labs. And according to the article, an appeals court revived claims against the NCAA by the parents of a person who had a fatal heart attack during basketball practice, not knowing he had sickle cell disease. At the time of Jack Hill Jr.'s death in 2011, the NCAA had mandated testing for the sickle cell trait at Division I schools, but not at Division II schools. Hill played basketball for Slippery Rock University, a Division II school in Slippery Rock, Pennsylvania. The NCAA began mandating testing for sickle cell at Division II schools in 2012 and Division III schools a year later. In addition to suing the school in the Butler County Court of Common Pleas, Hill's parents seek to hold the NCAA liable for negligent supervision of Division II schools. They appealed to the Pennsylvania Superior Court when the trial judge dismissed their claims against the NCAA with prejudice. On Tuesday, a divided three-judge panel reversed that decision. We agree with the appellant's position that at this stage of the proceedings, the trial court erred in concluding that no recovery was possible, Judge Jacqueline Shoden wrote for the majority. Hill's parents note that their son completed a physical examination to participate in college basketball, but that documentation of sickle cell anemia was left to a questionnaire. At no point did anyone require or request a blood test to check for these diseases. No one informed Mr. Hill of the dangers of sickle cell anemia or sickle cell trait, Shogun wrote, summarizing the allegations, abbreviating the disease and the trait. Shogun called it reasonable for a fact finder to conclude that the NCAA's decision to test for sickle cell trait at Division I schools as part of its protocols, while foregoing such testing at Division II schools, was an error of omission and a failure in its duty, thereby increasing the risk of harm to Mr. Hill. The opinion notes a dissent by the President, Judge Emeritus John Bender. So, people are now going to continue that case as they try to determine whether or not the NCAA was liable, because they did not have uniform sickle cell trait testing in place for all of its division schools simultaneously. What bothers me about that particular story is that Mr. Hill, the son of the family who is suing the NCAA, Mr. Hill apparently did not know that he had sickle cell disease, and he was in college. That sort of, I'm not sure I can understand that. My last story for today is coming to us from the hometown of Prince, Minnesota, Minneapolis, Minnesota. And the headline goes, Minnesota mom battles 2 years for adoptive child. And the story reads, a Minnesota mom waited years to be able to spend her Mother's Day with her daughter. Justine Tappel adopted 3-year-old Ida almost 3 years ago from the Democratic Republic of the Congo. Just weeks shy of being able to bring Ida home, the Central African country suspended overseas adoptions in September of 2013. Tappel spent the next 2 years trying to work with elected officials like U.S. Senator Amy Klobuchar from Minnesota to bring Ida home to Minnesota. It was immediately like she was my daughter, Tappel said. Ida was about 8 months old when her young birth mother could no longer care for Ida's sickle cell disease. Ida ended up at an orphanage in the Democratic Republic of Congo where Justine Tappel first met her. She was 13 months old and she weighed 11 pounds, she said, and I just remember the orphanage nanny handing her to me and I could feel the bones in her bottom. I was holding her and I just knew I would do anything for her, Tappel said. Justine never imagined just how much she would have to do to bring her daughter home. In September of 2013, the Democratic Republic of Congo's president suspended issuing paperwork that would allow hundreds of children like Ida to be with their adoptive families overseas. They had concerns about how the children were coming to be orphans and needing families, Tappel said. Senator Klobuchar said Minnesota has one of the highest rates in the nation for international adoption. These kids should not have been political pawns, Klobuchar said. With the help of other lawmakers and parents, the two women continued to pressure the Democratic Republic of Congo's government to allow children who had already been adopted to get the final steps needed to be with their adoptive families. Klobuchar said these types of bans have happened in several countries around the world, and there are hundreds of children waiting to be adopted. It was sudden and unexpected, and they have political reasons for doing it, Klobuchar said. At some point, our president actually talked to the president of the Congo himself to try to move this because these kids were just stuck in this political mess. It was an emotional roller coaster, something I've never felt before, Tappel said. You worry if she is sick or getting the care she needs. 2 weeks ago, Ida was finally granted the proper paperwork and permission to come home to Minnesota. It was all worth it, Tappel said. I feel confident. All my kids are under one roof. They're safe, they're healthy, and I'm able to take care of them as a mother wants to. And it's an interesting story because Miss Tappel decided after meeting little Ida in the Democratic Republic of Congo that she wanted to adopt her. And she was very willing to adopt a child with sickle cell disease because she knew that she needed extra care and she was willing to give it to her. That's our sickle cell news update for today. We're going to take a break, and when we return, we'll start talking with Mr. Saleem Adams about transfusions and living with sickle cell disease. This is the Sickle Cell Action Network Internet Radio Show. I'm Gary A. Gibson, your host, and we'll be back. The Sickle Cell Action Network, this is Gary A. Gibson, your host, and I'm delighted that I have a really cool guy in the studio with us today. His name is Saleem Adams, and Saleem is very talented and a very good conversationalist. And he has a lot to say. He's got a heck of a life story. We're going to get into some of that with him, and then we're going to have him tell us about, the transfusion process, living with transfusions as a part of his life. But the first thing, as always, Saleem, welcome to the Sickle Cell Action Network.
Thank you.
We're glad to have you, and what we always do is ask our guests to tell us a little bit about themselves. Where were you born? How old are you? What is your hemoglobin type? Those kinds of things, so the people that are listening can get a sense for who they're listening to. So, tell us a little bit about yourself.
Well, my name is Saleem Adams, like you said.
Okay.
I'm happy to be here, first of all. I think the show was great. I'm 42 years old. I was born in Indianapolis, Indiana. in 1973, and at that time, there really wasn't much teaching about sickle cell. So I was diagnosed with SS, hemoglobin type, when I was 10 months old.
Okay.
So before that, my mother said that I would just cry and cry and cry and cry sometimes, and nobody knew why.
Right.
Until she took me in to the doctor, because testing was not mandatory at birth back then.
That's correct.
So now that it is, thank God, now we can get a jump on things, from infancy. So, I spent 7 years here, I believe it was, and then my mother moved us to Virginia, Norfolk, Virginia.
Okay.
But before that, we moved back and forth periodically between Indianapolis and Virginia. And when I was 3 years old, we lived in Newport News, Virginia.
Okay.
And I was the first poster child for sickle cell anemia there.
Really?
At that center, yes,
Okay.
it was. Yep, still have the newspaper clipping. They spelled my mom's name wrong, but still have the clipping though.
Gotcha.
We went through, my mother and I, actually the whole family went through a lot. Dealing with sickle cell. My mother was a single mom. She raised 5 kids, including myself. And at the time when I started getting sick, my brothers and sisters didn't really understand. My mom didn't barely understand, at that time. She was still learning herself. And when I became of age to know what was going on, I remember being left in the hospital by myself. And I remember later on my mom telling me, she has 4 other kids at home who need her, and I was young, but I tried to understand, okay, I'm not the only one here. I might be the baby, the youngest, but I'm not the only one. So it took a little bit of time to get used to, being in and out of the hospital and everything. I had a good team of doctors growing up, and it's just really, it's been a journey. It really has.
Well, thank you for sharing that. We invited you to be on our show to talk about transfusion therapy. We're going to get to that shortly, but before we do, I'd like to ask you a few questions about your life with sickle cell. You've already started into this, but the first question I'm going to ask you: are you the only one in your family who has sickle cell?
No, I'm not. I have a younger cousin in Virginia with sickle cell, and I also have a nephew who lives here with sickle cell. I had an aunt who passed away from sickle cell complications, and right now I have a son that's been diagnosed with SS.
Right, we're going to talk about that too. So the others that you mentioned, are you familiar with what their hemoglobin types were or are?
My nephew and my cousin, they both also have SS.
Okay.
Yeah.
Okay. So how old were you when you first learned that you had sickle cell? You said you were diagnosed at 10, but how old were you when you started to learn that?
Let's see here. Actually, wow. I think I started to understand when I was around 5 or 6.
Okay.
Is when I started to understand, because my pain crisis got much more severe at that point. And it was just something that I just could not ignore.
So earlier on, as you were getting up to 5 or 6 years old, you had problems, but not as many, and then it got worse?
Correct. My mother said that when I was a baby, I would get leg ulcers as a baby, which fortunately I don't remember. But she said, it was other complications involved as well. But that's about as far back as I can remember that I started to understand that I had sickle cell.
Did you understand at that time what that meant? Or how much longer after the time that you understood you had sickle cell, how much more time was it before you actually started to understand what that meant?
Well, I really did not understand the dynamics of it at that time. I'll say about 3 or 4 years later on is when I really started to understand, because the pain episodes kept happening. So I started to understand that it's not something that's going to go away. You know, it's something that's going to continue to occur, and it'll probably be something that I have to deal with for the rest of my life. You know, so that was a challenge.
It was a challenge. I know it was a challenge. How did you cope with that at that age? Do you know?
Let's see here. I really didn't do too much coping with it. When the pain crisis came along,
You just dealt with it.
I just dealt with it at that time. But my mother, as I got older, she taught me how to recognize my triggers, and then she taught me things to help to get me through the crisis. You know, she and the doctors and the Sickle Cell Society in Virginia, they helped me to know what to do when I am in a crisis, when a crisis first starts, and all that good stuff. So it took some time.
What are some of the triggers that she told you about?
Well, she told me about jaundice, number one. When my eyes would get yellow, to be careful. I outgrew my eyes getting yellow, you know, the jaundice. I outgrew that early. So what the other triggers was fatigue, always being thirsty. So I had to make sure that I recognized when I was doing too much, when I haven't gotten rest for a long period of time. You know, I couldn't make my days too strenuous. I had to make sure that I got rest. And if I got too cold, that was another trigger. And playing hard. So I'll say by the age of 8 years old, I stopped running.
Okay.
And because I was a serious trigger, you know, me running. I was always ended up in the hospital for like 2 weeks, you know, after running. Sometimes I just run across the street, and I'm in a full-blown pain crisis.
Wow. Okay. So would you mind talking a little about your earliest memories of being treated for sickle cell? Please tell us some about the experiences that you remember.
Wow.
You made a mention of the fact that you had good doctors, or you think you had good doctors?
Yeah. My earliest memories. Excuse me.
Sure.
My earliest memories were here in Indianapolis, and I would get sick, and my mother would just, you know, she would give me Gatorade and water, and I was able to take pain meds at home. You know, wasn't anything heavy at that time. I think it was just like aspirin or something like that, Tylenol, maybe with codeine. And then as time went on, as I got about 4 or 5 years old, I think it was, is when I first remember going into the hospital.
Okay.
You know, and that really took some time to get used to. I remember, you know, sometimes I would just cry and cry and cry because I had to watch my mom walk down the hallway, and I knew she wasn't coming back for like until tomorrow or whenever she would be able to come back. You know,
That's hard.
yeah.
That's hard. Well, thank you for being so honest. We're going to take a break, and when we return, we'll continue our discussion with Mr. Saleem Adams. This is the Sickle Cell Action Network, and I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network. We are speaking with Mr. Saleem Adams, and we're having a great conversation. And we're going to continue that conversation with me asking you another question, Saleem.
All right.
So, how would you say the doctors were prepared for dealing with your sickle cell in the earlier days of your life?
Wow. The very early days, when we lived in Newport News, Virginia, I had a doctor named Dr. Cypress and his Nurse Fox, and they were extremely knowledgeable and diligent about dealing with children who had sickle cell. I remember my other doctors, Dr. Warfield, and other doctors who really knew what they were doing. And some of these doctors stopped their practices just to go into study for sickle cell. So I had a very good team of doctors, but the problem was when I had to switch doctors.
Okay.
Because, like I said, we moved back and forth between Indianapolis and Virginia several times. So getting back, especially when we went to Virginia, finding a doctor in Virginia that was not only knowledgeable but was willing to take sickle cell patients, that kind of became a challenge for my mother. And I did notice that a lot of times it would take, some of their procedures were in protocol were just completely off kilter. Like one doctor, he didn't want me to go into the hospital no matter how severe, but what he wanted my mother to do was to bring me into the office when I had a sickle cell crisis. So she would bring me in during the day for IV and IV fluids and pain meds. Then that night she was to take me back home, and then the next day bring me back to the practice, instead of just having me in the hospital or having home health care, so where I could get that continuously without that break, that pause. So it was a challenge when switching doctors, because some of them did some off-kilter things. They really did. But for the most part, I had pretty good doctors.
Now, sometimes, though, you may have, as many other sickle cell patients have, encountered issues when you go to an emergency department. Has that been true for you?
Yeah. I have.
You say that with a chuckle.
I have to. It has been some severe challenges. I remember one time my mother, we were living in Virginia. She came here to visit her family here in Indianapolis, and she left me with my cousins. My cousin was a nurse, so she knew what to do, and I had to go to the emergency room. Well, the nurse in the ER did not know that my cousin was also a nurse at that same hospital. So my cousin overheard the nurse saying, I'm not giving him this pain medication because he's probably just a drug addict seeking, pain meds. So, make a long story short, that nurse never worked at the hospital, any hospital in Hampton Roads, Virginia anymore. Thank God. And, it was just an ongoing battle with them thinking that I'm seeking for drugs. One doctor tried to say he knows every single sickle cell patient in the Hampton Roads area in Virginia. So I said, oh, really? I said, do you know such and such a person? Oh, you mean the big girl? No, she's not big at all. She's a tiny person. I don't think I met that person. Well, they would just come up with some of everything. And as I got older, is when the problems really started. As a child, everything was smooth sailing for the most part. But as I got older, I became a teenager. And especially when I became an adult, that transition was extremely hard for the ER.
Yeah, and that's basically, it happens over and over and over again. You are one of many that have had that kind of experience. So what about your family, Saleem? Please tell us a little bit how they've supported you when you were growing up.
My brothers and sisters were very, very supportive. It took some of them, a little bit of time to understand that I wasn't just after attention when I would get sick, and it wasn't something that I was faking or whatever, to get my way in a certain area or whatever. But once they understood the dynamics of everything, once they saw me in those severe pain crises, they never second guess it again, ever. Yeah. My mother did teach them, how to help to take care of me. So my biggest advocates were my mother and my oldest sister. They were the ones that really, took care of me the most. But the rest of my family members, some of them, the extended family, some of them understood and some of them didn't. And for those that did not understand the dynamics of sickle cell anemia, they still understood that my mother had a child at home who was, sick and needed special care, So they were pretty supportive.
One of the most powerful things that happens sometimes when it's regarding sickle cell is that when someone actually sees the patient in crisis and in the pain, and that's really what can capture their attention and capture their compassion. A lot of times it's that it's just a word, it's a phrase, it's nothing more than that. It means nothing to people. But when they see people suffering in anguishing pain, it gets their attention.
Yeah, it does.
Yeah,
it does.
Their attention, and it makes a difference in how they respond to you from there on out.
Mm-hmm.
So let's move over to another topic, and this one we've talked about a lot on the show, and in fact next week we're going to talk about it some more. Getting an education. Getting an education is often very difficult for many sickle cell patients for a number of reasons. What was it like for you?
Yeah, it was very, very difficult for me. I noticed when I first started school, from kindergarten, I'll say, to the first grade, everything was good. I was an A student, I didn't miss a thing in school. But as the pain crisis became more frequent, I remember 1982, the second grade, is when I really started to miss a lot of school. So, I missed about 2 weeks of school because I'm in the hospital or whatever. When I come back to school, the teachers have moved on to something else. And now I have to catch up. And instead of them pairing me with another teacher, or instead of them taking the time out themselves to catch me up, they would rather pair me with another student. Well, that caused problems too, because if I didn't understand something, that student wasn't going to be patient and understanding enough, not to tease me or something like that. So it got to a point where I began to hate school. I didn't want anything to do with school. And by the time I did graduate, I knew I wasn't going to go to college right after high school, because I wasn't ready to take it serious, because I was frustrated and fatigued with school, period. And the gym sessions, every single year I was threatened that they were going to fail me for gym class because I would not run the mile.
Wow.
No matter how many doctor's notes I bought in, no matter how much documentation I had, they still, with every single gym class, let's go, Adams, let's go. And I just started, I didn't want to get rebellious, but at the same time, I had to get them to understand, because I was getting frustrated. So I just asked one gym teacher, I said, I'm not running the mile. Well, I'm going to fail you. I said, well, are you going to be there at 2 in the morning when I'm in the hospital crying out in pain? Are you going to be there with my mom? Are you going to come and relieve my mother so she can go to work, so she can make money, so our household can continue to run? Are you going to do that for me?
Oh, wow.
And he couldn't say anything, so he sent me to the office.
So you were standing up and advocating for yourself.
Yes.
That's good.
Yeah.
That's good. But it's also bad that they didn't see what their responsibility was.
Right.
That they should not have been trying to force you to do that.
Right.
And threatening you with failing you. That's ridiculous.
Yeah.
So, do you remember how old you were when you had your first blood transfusion?
I don't remember how old I was when I had my first blood transfusion. I do remember my mother saying I was a baby, or just a few years old or something like that. So I don't remember the first time, but the first time I do remember having one, I believe I was 10 or 11 years old.
Okay.
And I woke up and in the hospital, and I'm looking at the IV, which was normal to me. But instead of the saline bags, I'm looking at bags of blood, and it freaked me out. I'm like, what the heck is going on?
Yeah.
But so, that's the earliest I remember getting a transfusion.
Now, some patients have to get transfusions for different reasons. Sometimes because they've had a stroke, or there's a fear of a stroke and things like that. Was there any particular reason that you're aware of that caused them to start transfusing you?
I believe it was fear of a stroke.
Okay.
I know my hemoglobin was extremely low.
Okay.
And I had an infection. I forgot what kind of infection it was, but they were telling my mom, that it was a good thing that I got the blood, because without that blood, things could have gone downhill, way faster or worse.
So, do you remember how you felt? You sort of talked about being freaked out when you saw that blood, but how did you feel? Were you afraid in any way?
Yeah, I kind of was afraid. I didn't quite understand what was going on, and I didn't know if it was blood that I had lost, that they had taken out of me, or if it was someone else's blood that they were putting in. And if it was someone else's blood that they were putting in, then why did I need somebody else's blood? And is this good for me, or is it bad for me? Is it going to change me in any way? So I had a whole lot of questions about it.
Did they give you answers? Did they try to explain? Or, you maybe weren't in the position to ask those questions. Those are questions you were thinking and feeling. But did they explain what was going on to you that you can remember?
Yeah, they did explain to me what was going on. One doctor explained, that they were introducing healthy cells into my body to help to fight off the sickle cells in my body and to shorten my pain crisis. So that was the main thing that I understood.
And then when you heard that, it made sense to you.
Right. Then it made sense.
Yeah. Okay. Well, that's one of the things that we worry about sometimes here is that sometimes procedures take place and people don't exactly know why those procedures are taking place. One of the issues, I think, with some doctors is that they, whether it's because they have too much to do, they're running too fast, they've got too many patients to see, whatever, they sometimes don't necessarily take the time to explain what they're doing. And a lot of patients aren't of the mindset to ask why they're doing this. So I think that's an important lesson for everybody that's involved is if they don't explain it to you, ask.
Right.
Again, this is about advocating for yourself and trying to understand. The more you ask, the more you learn. The more you learn, the better off you'll be.
Right.
And so that's why I was kind of going down that road with you. So actually, at this point, how often do you receive transfusions, Saleem?
Right now, I receive transfusions every 6 weeks.
Every 6 weeks.
Yeah, it's called a blood exchange transfusion. So instead of them just introducing someone else's blood to me, what they do is first they give me a few bags of saline, and after they run that, then they take some of my blood out, and then they introduce someone else's blood into, so that's the exchange part right there.
We want to have you tell us a little bit more about that, but I think we're getting close to taking a break. And I wonder if you would just tell us how long do you think you're going to have to receive blood transfusions?
Well, I probably for the rest of my life. Actually, moving here from Virginia, I was not getting any exchanges in Virginia, and I was constantly in and out of hospital in a pain crisis. But since we moved here, and I am getting those exchanges, I have only been sick. I've only had a pain crisis one time since we've been living here. It'll be 4 years next month that we've been here. So the pain episodes have really, really diminished. Now if I have a pain episode, it might last 5 minutes maybe.
Wow. Yeah. So it does make a difference.
Oh yeah, definitely makes a difference.
And I can't believe it's been 4 years since I first met you when you came over to
see us. Yeah.
That's incredible. 4 years.
Yeah.
We're going to take a break. You're listening to the Sickle Cell Action Network, and our guest today is Mr. Saleem Adams, and I am Gary A. Gibson, your host.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site.
Welcome back to the Sickle Cell Action Network, and I am Gary A. Gibson, your host, and I am speaking with Mr. Saleem Adams, who is talking with us about living with sickle cell disease and also about the blood transfusion process. It's a big part of his own life. So we're going to continue talking about that, and we actually started a little bit ago about transfusions and what that's like. So the next question I had for you, Saleem, is, do you have to make any special preparations before you do a transfusion?
Yes, I do.
Tell us about that.
My doctor put me on a medication called clopidogrel, and what that's for is to begin to thin the blood out, so that way during the transfusions the blood doesn't clot the needle and the tubing, so that way I won't have to have any delays in the process. So I start taking that 5 days before each transfusion, and then the day of is when I stop taking it.
Okay.
Outside of that, only other preparation I really do is make sure I take a shower, because after the needles come out, after the procedure is over with, I can't shower for like 24 to 48 hours after that.
Okay.
So yeah.
Why is that?
Because the needles that they use are so large. When they pull them out, it leaves the skin kind of open still, so they don't want any bacteria to get in there and infect the port, my metaport.
Okay.
So
okay.
Yeah.
And so when you take, what was the name of the medication again?
It's called clopidogrel.
Clopidogrel, and you take that for 5 days prior to, and then you stop the day of. Do you have to do anything afterwards besides not take a shower for 24 hours?
No, the only thing I really have to do afterwards is make sure I don't get that bandage wet, like I said, and also make sure that I get plenty of rest, because it is exhausting having that procedure done. So
yeah, I imagine it is. Do you receive the transfusions at the same place all the time?
Yes, I do.
Okay, where is that?
That's over at IU at the apheresis center.
Okay. And how long is that process from start to finish?
Let's see, from start to finish, I get to the clinic around 8 o'clock in the morning, and I'm usually done around, if there aren't any complications, I'm usually done around noon, 1 o'clock, something like that.
Okay, so about 4, 5, 6 hours.
Yes.
And that's every 6 weeks.
Yes.
This is one of the things that would like people to understand, that this is another aspect of your life, and it takes a lot of time out of your life, but it's for good reason. It's helping you feel better.
Yeah, it is. It really is.
Okay. And then, so I guess do you get the same amount of blood exchanged every time? Is it like clockwork?
Yeah. Basically, they try and give me the same exact amount. Sometimes if my count is still good from the previous exchange, they might skip a bag or two, but other than that, they try and stay on target with the same amount every single time.
Mm-hmm. A lot of people are reluctant, I think, sometimes to receive transfusions because it means that they're getting someone else's blood. Was that ever a concern for you?
Yeah, it was a concern at first, but with I was assured that the way they check the blood, they check this blood several different times, and they check it several different ways for antibody screening and diseases and things of that nature. So like the antibody screening, my blood has a lot of antibodies in it, so my body produces a lot of them, so they have to find a blood that's compatible for my antibodies, so I won't have severe complications. So it was some questions involved and some doubts at first, but the pros outweighed the cons, and I had to give it a chance, because if it was going to cause me to not have as many pain crises, or cause a pain crisis not to be severe and as long, I had to try it. I had to try it. Anything that will shorten those episodes or get rid of those episodes without killing me, yeah, it was worth a try.
It's worth it. Would you explain in your terms what it's like to have a pain crisis?
Wow. pain crisis for me, a mild one would be if you've ever bruised a bone or something like that, or if you've ever been in a fight, you have bruised ribs or whatever, you touch that area, you might wince a little bit. But, for the most part, you can still function normally every day. A moderate pain crisis would be that the bone is broken and it's constantly being agitated. A severe one would be that someone has placed my bones in a hydraulic press or something like that and crushed them into little tiny pieces, and then I'm wringing my limbs out like a damp washcloth repeatedly with no relief, or I'm being beat with a spiked bat repeatedly for about 5 days straight, and there's not really too much pain medication can do. I mean, it does dull the pain a little bit, but that pain never goes away for those few days. It doesn't really go away. The pain medicine might take it down on the pain scale, but for the most part, even though pain medicine makes you sleepy, with sickle cell you really don't get any rest when you're in a pain crisis, because it's 9 times out of 10 if I have to go to the hospital, when someone steps off the elevator, I've been told that they can hear me screaming and hollering in pain when they step off the elevator, because that's how severe it is. I've been on morphine pumps, dilaudid pumps, I've had Demerol, some of everything, and nothing really takes that pain away. So it can be quite bad. It's a bad experience. Can't do anything but just lay there, and hope the episode ends quickly.
Saleem, thank you for sharing that. And I think you did a great job in explaining that, your analogy of the bruise all the way up to the crushed bones. That's really good. Thank you so much for that.
Mm-hmm.
So back to the transfusions. We talked a little bit, and you mentioned that you did have concerns about complications that might arise. So I'm going to ask you, have you ever had any complications arise during transfusions or after?
The only thing I've had to happen during the transfusion is the needle getting clogged, because the platelets in my blood are too sticky, and it starts to clog the needle. Then they have to pause the procedure and introduce a blood thinning agent into my port, so that way everything can flow smoothly. And outside of that, the only other thing I have experienced was maybe a little bit of itchiness, but they give Benadryl for that, and sometimes my lips will tingle, and what that is, that's because of lack of calcium.
Okay.
So sometimes they will have to introduce calcium to me while I'm doing the transfusion, while I'm having that transfusion. But outside of that, I've had no major problems during the transfusion or after the transfusion.
Good. Glad to hear that. Let's talk about that port for a minute. How long have you had a port?
I've had a port for, let's see here, about 8 years now. So the port really has helped out a whole lot, because the reason why they gave it to me in the first place wasn't for the transfusions. It was because I didn't have any good veins left. Mm-hmm. So when I would go into the hospital, it was very, very, very hard for them to find a vein to get an IV on me. Mm-hmm. So with the Metaport, I didn't have to go through that anymore. It was easy access all the time to take blood and to administer medications.
Mm-hmm.
Yeah.
And how do you care for the port?
Basically, when I go in for my exchanges, they take my blood and everything, and then after that they give I can't remember the name of that medication, but it keeps the port from clotting up. It keeps that tubing from clotting up. Mm-hmm. They'll put that in there after the exchange is over with, and that's how it's maintained. Basically, I don't have to really do anything to it. It's under the skin, so the skin grows right back over it, so it's never open to the elements at all, and I can do anything that I want to do. You know, go to the beach, go swimming, shower, bathe, whatever I want to do, because that port is protected by the skin, and so there's no chance of bacteria getting in there.
Great. Thank you for being so open and sharing. We're going to take a break, and when we return, we'll continue our discussion with Mr. Saleem Adams. This is the Sickle Cell Action Network. Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and we are speaking with Mr. Saleem Adams. We've been talking a lot about the blood transfusion process, and maybe one or two more questions about that, Saleem, and then we're going to move on to some other topics. So one of the things that is always important when we're talking about blood transfusions is what's known as iron overload. Have you had any issues with iron overload? And if so, tell us about it, and if not, do you know why that is?
I have not had any issues with iron overload, fortunately. And the reason for that is because it's not a regular blood transfusion. Like I said, it's an exchange.
Exchange, right.
So instead of the iron overload coming quickly by just introducing someone else's blood all the time, that caused that iron to build up very, very quickly. So by them taking some of my blood out, and then introducing somebody else's blood, that diminishes the chance of iron overload. There is still a chance of it, but that chance is greatly diminished because of the exchange process.
Okay. And you don't take any medications for that?
No.
Okay.
No.
Okay. So I'm shifting back to sickle cell now, and have you talk with me about that. You did a really good job of describing what a crisis is like a few minutes ago before the break. But now I'm going to ask you, how do you describe sickle cell to other people that you encounter?
Well, for those that don't know about it, in a nutshell, I will tell them that it is a blood disorder that the bone marrow does not produce strong, healthy cells. It produces sickled cells at the time of a crisis. So those cells, they break up into sickle pieces. They lose their lubrication. They can't pass, through each other or past each other, which causes the pain. And I also let people know that just by looking at someone, you can't tell that they have sickle cell anemia, but for me, I'm 42 years old, and I am a lot better off at my age than other people with sickle cell, because a lot of times by now, people have had hip replacements, strokes, heart attacks or whatever. I haven't had any of that stuff, but it does take a toll on the body, and it breaks the body down as time goes on. So for me personally, they have been trying to replace my hips, and I'm partially blind in my left eye. It has affected my teeth. So anywhere you have blood vessels, it can affect that area of the body.
Which is any part of the body.
Right, exactly.
Right. A few weeks ago, we had a Dr. Rakesh Mehta here who practices at IU Health Hospital, and we talked about how sickle cell can affect every part of the body, and we actually went system by system, and he talked about the kinds of things that sickle cell can do. It was a pretty fascinating show, and those that might be interested can find that show on our YouTube page, because we are uploading all of our shows to the YouTube. Before we continue, I want to be sure that we let you know that the Sickle Cell Action Network show is sponsored by Mast Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. Mast is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaxamers. Mast has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. Mast has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Palaxamer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It may also reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation has been free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they might also be helping future generations of those yet to be born. If you're interested in learning more about the EPIC study, please visit www.theepicstudy.com. Thank you to Mass Therapeutics for their sponsorship of the Sickle Cell Action Network. Speaking with Saleem Adams. Saleem, what percentage of the people that you talk to really understand sickle cell?
I'll say about maybe 5% of the people that I talk to really understand sickle cell. So that's a very, very small number, of course.
Sure it is.
You know.
Sure it is, and probably people that you would think know more, and then you start talking to them and you find out they don't know.
Right.
That's right.
Right.
So I understand that you're driving for Uber nowadays.
Yes.
That's pretty interesting, pretty cool. How long have you been doing that?
Since August of last year, so I'm coming up on a year.
Okay. And it seems to me that driving for Uber might be a good way for other sickle cell patients to make a living. Would you agree with that?
Yeah, I would have to agree with that, because if I don't feel like going into work, I don't have anyone that I have to answer to. Nobody has to cover my shift for me. I'm not calling in to work sick and, having the manager question if I'm telling the truth or not or anything like that. I get to get out in the city, meet new people, and make some money while I do it on my own schedule. So if I want to work for an hour, then go home, call it quits for the day, I can do that.
That's one of the things we've talked about also in the show before, is employment and sickle cell, and it's a very, very difficult thing to do. And what we want to do as we go forward with our show is try to highlight areas where people could consider trying to make a living. And for the reasons that you just said, that's why I think Uber might be a good thing for sickle cell patients.
Yeah.
So for those patients that might be interested in driving for Uber, and this isn't a commercial for Uber, but it's an idea that there are things that you can do to make money. How would people go about pursuing a chance to drive for Uber? How did you do it?
Basically, you just go to the website, uber.com, and all the instructions are there. It's a very easy process. You sign up, and you start driving. You can start driving almost immediately and making money. So you get paid once a week. Depending on how much you've driven that week, depends on how much you get paid. It's a good thing, I believe, because Uber keeps 20%, I'm sorry, and the drivers keep 80%. So I get to keep 80% of what I make. So if I, want extra hours, I can drive. There are no limits to how much I can drive or how much I have to drive, So I really like it.
So if you were able to drive for 30 hours a week, about how much could you make?
30 hours a week, it depends on the week, actually, really.
Okay.
On a normal week, when there's really nothing big going on in the city, I'll say you can clear about $300, 30 hours or something like that. But if there's a main event going on in the city and you're driving for like the weekend or something like that, if you just drive for the weekend, beginning Thursday night into Sunday morning, you can clear about $800.
Wow.
Just part-time. and that's not including tips.
Wow, okay, that's good.
Yeah.
So maybe people want to kind of check that out. Back to sickle cell, from your perspective, what is, in your mind, the hardest part about living with sickle cell, and why is that?
Well, for me, it has changed over the years. So when I was a kid, the hardest part was school and the relationships. And as I became an adult, it was mainly holding a job and relationships. So relationships have always been in the dynamics, always. Because whether you're trying to make friends, some of your friends understand, some of them don't. And I can remember growing up, I've only had one friend that I can remember to ever come and really see me in the hospital on a frequent basis.
Really?
Everybody else, they're your friend, but until you go in the hospital, they're not going to call you on the phone. They're not going to come and see you. And then when it comes to dating relationships, as soon as I would tell someone I had sickle cell anemia, the relationship was over, basically. So when I met my wife, I made my business to start telling people up front, I have sickle cell, because let's just cut that process out. Let's just cut out the guesswork. I have sickle cell, and either you're going to stick with me or you're not. And my wife hung in there. So.
And you just told me you're about to be married for how many years?
16 years next month.
Awesome.
Yep.
Good job, Tamara.
Yes.
Good job, Tamara. I know you're listening, so that's just for you. So we're going to take a break, and I guess it'll be our last break for the show, and then we'll come back and we'll complete our discussion with Mr. Saleem Adams, and we'll wrap up the show. Thank you, Gary A. Gibson, your host, and we're speaking with Mr. Saleem Adams, who's been telling us about living with the blood transfusions in his life and living with sickle cell. Great inspirational guy here. So I'm going to start wrapping it up, Saleem, but there's a story that I'd like you to share. I recently learned that you have adopted a pair of twin infant boys, one of whom has sickle cell disease. It's a tragic story in a way, but it's also a very moving story. Would you please share that story with our audience?
Yeah, we had a friend, my wife and I. She was more like our adopted daughter, and she ended up pregnant. She asked us to adopt. We kind of hesitated. When she gave birth, she found out that one of the babies was diagnosed with SS, and that motivated her even more to want us to adopt, because she understood that I have dealt with sickle cell in my life, so she felt like she was giving them a good place to go where people would be understanding. We have already gone through so much stuff with sickle cell that the baby would have people in place, a good support group in place already for that baby to have a good chance at a normal life, or as close to normal as possible. So it was bittersweet because the young lady passed away. But before she passed away, she made sure that she told everyone, and made sure that everyone understood that she wanted the babies with us and no one else. So they have been a blessing. They are 3 months old. They're starting to, laugh and cool and play and everything, and it's just amazing at seeing them go through the different stages of infancy. They are first children, so we're having a blast.
Cool.
We really are.
Cool. Well, it's just tragic that the mother passed away, but it's not tragic that the kids are in a good place with people that will be able to understand what they're going through and help them, guide them through that. Saleem, there's a lot about you that is inspiring to me, and I'd like to commend you for being what I think is a strong sickle cell adult role model.
Thank you.
What words of advice would you have for young boys living with sickle cell?
Well, number one, know your triggers. pay attention to your body. You might even want to keep a journal to when you do have a pain episode, you log what caused it. You journal in your life, so when you go back and you have a pain crisis, you can go back and see what's in common. Okay, I had a pain crisis this time. Let me check and see the last time I had a pain crisis, what was going on in my life. Because it could be you were too cold, you were dehydrated, you were fatigued, stressed. Each person's trigger is different. And one thing that I really stressed when I was growing up was, I had a lot of friends that were sleeping around and everything. And I could have had my choice of whoever. But I would tell everybody, I don't know if this girl has a trait or not. And I'm not trying to bring a baby into the world with sickle cell, especially when I'm so young. I hadn't even graduated from high school yet. And that's something that it's a responsibility that's not to be taken lightly. So you need to be careful about that also. But the best thing I can say is learn your triggers. Learn what throws you into a pain crisis and start to see what's coming ahead. The Bible says a wise man sees trouble from afar. So use that wisdom and see what your trouble is before it hits you. And then that way, you can either prevent a pain crisis, or you may even be able to expedite the process and get yourself out of that pain crisis a lot quicker than you normally would.
I think that's excellent advice. Let me ask you, did you, as a youngster or even in your middle ages, did you connect with other people with sickle cell?
I really didn't connect with too many other people with sickle cell growing up, because nobody wanted to talk about it, so you didn't really know who had sickle cell. And come to find out, as I got older and, social media is as big as it is now, I'm learning about people that had sickle cell that I went to school with that I never knew had sickle cell because they didn't want to talk about it. So I didn't really get a chance to connect with too many young people with sickle cell as I was growing up.
Now, were you like that too? Did you not want to talk about it? This has been a topic we've covered several times on the show.
Yeah, sometimes I did not want to talk about it, but that was mainly like in elementary school. By the time I got to junior high and high school, I didn't care who knew, because I felt like the more people that knew, then the better off I would be, and the more people would know what was going on with me if I did have a pain crisis and I wasn't at home. I'm away from my mom, my support group, or whatever. So, and in junior high school is when I really started to open up about it, and in a few instances it did pay off. When I got sick, people knew either what to do, or they knew that they need to be doing something, and they need to be doing it quickly. So, I began to share at an early age.
So is that some advice that you would give to some of the other young boys, is, not be so secretive about it?
Yeah, definitely, talk about it with your peers, definitely. And if they don't understand, you might want to invite them over one time when you're having a bad pain crisis, so they can see, this is not something to be taken lightly. When you're in the hospital, make sure some of them come and see you, in the hospital, so that they can see that this is not anything lighthearted. It's not asthma or anything like that.
Made up.
Right. It's not something I made up. It's not something I'm just, playing around with or whatever. No, it's just something that's serious. So opening up and talking about it is a good thing.
All right. So let's imagine that you had a chance to participate in one of the many presidential campaign town hall meetings that we'll be seeing during the upcoming months. If you had the chance, what would you ask the candidates to do for the sickle cell community, and why would you ask that?
Wow, that's a good question. I have so many things on my mind, but one thing I would ask them is to help us to get the word out. Help us to bring sickle cell to the forefront so that people aren't ignorant about sickle cell like they are now. whether you're in the medical community or whatever. Help us get the word out. That's number one. And then number two, not only help us get the word out, but help us to advocate for different treatment options, because pain medicine is not the only thing that can help to bring us out of a pain crisis. You know, jacuzzis and sauna in the medical facilities, that can work wonders, you know, and help to get us out of those pain crises even quicker, you know, if they would just do that. So I think those are just some of the topics I would ask, you know.
Okay. Is there anything else that you'd like to add today? This is your chance. I mean, you know, you're talking to the world about sickle cell. And again, thank you for being willing to do that, and then thank you for doing such a good job of it. But is there anything else that you'd like to talk about that we haven't talked about yet?
Support group. You know, it's very, very important that you have a good support group. It's very, very important that your inner circle knows about sickle cell. They're knowledgeable about sickle cell, and not just the fact that you have it. Let them know how it works, how it affects your body, what goes on. And also for the medical community, you know, better treatment in the emergency rooms. You know, we're not drug addicts. We're not just seeking pain medicine. So be a little bit more understanding when someone walks through the door in a sickle cell crisis. You know, we are in pain, we are in crisis, and it does not affect all of us the same. We are different. So what treatment may have worked for one sickle cell patient might not necessarily work for the next sickle cell patient that walks through that door. So just be a little more understanding, and I think we can, you know, make this process a little bit easier on all of us.
I appreciate your words, Saleem, and again, thank you for being with us, and thank you for sharing so much of yourself. It's been a delight to have you with us, and we probably would like to have you come back at another time and join us again if you'd be willing to do that.
I would love to.
As it is always the case, we close the show out with some things for you to think about, and we start with a closing quote. This time comes from Barbara Jordan. Education remains the key to economic and political empowerment. Barbara Jordan lived from 1936 to 1996. She was a lawyer, an educator, an American politician, and a leader of the civil rights movement. A Democrat, she was the first African American elected to the Texas Senate after Reconstruction. She was also the first Southern African American female elected to the United States House of Representatives. She received the Presidential Medal of Freedom among numerous other honors. Empowerment. It's a word that you hear a lot these days. That's a good thing, because empowerment is a necessary element for achieving change. But empowerment doesn't just happen. It has to be earned. Once it's earned, however, it has to be used in order for change to take place. That's important with any struggle, and it's important for the sickle cell struggle as well. In recent times, more and more people are becoming more and more empowered with regards to sickle cell. These are truly exciting times because of that. But like I said, power has to be used in order for change to happen. It's nice to know that the Energizer Bunny's batteries can power your electronic devices, but unless you insert the batteries, the power that they contain will be meaningless. So now that you are more empowered, the question becomes, what will you do with this new power? How can you use this power for good? Well, that depends on what your role is. If you are a patient, you can use this power to help yourself better manage your condition. If you haven't yet started taking hydroxyurea, you should now be more inclined to do so. Because you are more empowered, you can more easily maintain a healthy life balance, including optimizing your mental health. But you can not only help yourself, you can help some other sickle cell patients that you have met along the way. I encourage you to go out there and form stronger bonds with other patients so that you can support each other through your more trying moments. If you are a provider, You can use the power to help each and every patient that you treat. Now that you are learning more about the benefits of treating patients holistically, you should be able to start caring for them with more and more confidence. You should also be more in tune with how to recognize cases in which assistance by mental health providers is indicated. But you can help not only your patients, but those of other providers as well. Please share what you have learned with them. If you are a caregiver, you can use this power to help not only your individual loved one, but some of the other caregivers that face the same challenges that confront you. I urge you to go forward and form stronger bonds that will enable you to boost each other when that assistance is needed. And if you are an advocate, you can use your power to help hundreds, thousands, even millions of others all around the world. You can do this by staying abreast of developments in the field and pushing whomever you can, whenever you can, for more progress with research, legislation, and financial support for agencies that serve the needs of people with sickle cell. So go out there and advocate like you have never advocated before.